Eastern Cheshire has one of the fastest growing ageing populations in England, putting increasing demands on health and social care services. To transform care to meet the demands in this region, the Caring Together programme, led by NHS Eastern Cheshire Clinical Commissioning Group, is being shaped by the experiences of everyone involved, including the public, patients, carers, volunteers and clinicians. Estelle Matthews went to learn about the benefits of this approach to transforming care.
Eastern Cheshire is a good place to live. People live long, mainly healthy lives and have access to high-quality services. The challenge is to maintain and improve the quality of these services and meet the current and future needs of one of the fastest ageing populations in England. Radical changes to the model of care are needed. These changes are being made with the full involvement of the area's partners and the public through a communications campaign championed by NHS Eastern Cheshire Clinical Commissioning Group.
The CCG, what they're saying is, we welcome your input, we'd like to have your input. We won't just do what you say, but we'll evaluate it and we'll use what is appropriate and take things forward in that sort of way. So this is the building of bridges and welcoming people across, and that's how I feel, that's how it makes me feel.
What arrangements are being made?
Health Voice is an important, influential patient and carer reference group in Eastern Cheshire. It encourages and enables members of the community to have a greater involvement in shaping their local care services by speaking directly to and influencing what Eastern Cheshire CCG does.
It's as much about behaviour and attitude of caregivers, be they social workers, psychiatric nurses, pharmacists, as it is about what they know or what skills they have. The culture of care has to change to think about the individual's needs and not about the needs of my organisation or my department.
Caring Together is a major programme uniting all care partners and the public to improve high-quality services.
What feels very different about Knutsford and East Cheshire is this absolute commitment from everybody to make it work. From day one in Knutsford, the CCG, the Acute Trust, the council, they're actually actively helping. And the other thing we have here is we've got a really mature joined up GP provider unit. So all the GP practices in East Cheshire working together and are happy to support the whole project, different ways of working.
Within Eastern Cheshire, as well as primary care, hospitals are a major partner in Caring Together, and they're involved in all of the work streams, coordinating professionals and patients to deliver this vital programme.
Oh yeah? Good. Are you managing to drink any more?
It's all about patients, and I think it's about giving patients the skills and the knowledge and the power to be able to support their own healthcare, working with us in primary care, secondary care, in an integrated way to get the best outcomes for themselves.
Integrated care can only be built on foundations of trust between our communities, the NHS, the local council and the providers. If you don't have that trust and you don't put the effort in to gain the right vision and the right principles, you cannot integrate care.
It's a huge challenge to build and sustain services for the future when budgets are tight. But through the Caring Together programme, Eastern Cheshire is demonstrating that by engaging with the community and reaching out to the region's health and social care providers, it's possible to deliver high-quality integrated services focused firmly around the needs of their patients.